50 times stronger than heroin, 100 times stronger than morphine. When it comes to fentanyl, a tiny little dose can be deadly. It's not something you can see, you can't smell it or taste it, which means there's a huge danger of not knowing if it's mixed with other drugs.
The Somerset County Health Department is pleading with folks to pay attention to this warning. And so joining us today is Prevention Supervisor Elizabeth Justice alongside Lieutenant Ray Johns of the Somerset County Sheriff's Office. Thank you both for being here. Very important subject. First of all, let's just, for those who are unaware, what is fentanyl?
So fentanyl is a synthetic opioid. It was originally designed late 50s for pain prevention, serious pain, cancer patients, typically used in a hospital setting.
So what is it that makes it so powerful and so dangerous?
It's the doses when they're not monitored by somebody that's in the hospital, when they're using them as illicit drugs mixed with other things, the amount that you need to ingest is very tiny. So it can lead to overdose. And the other thing is it depresses the respiratory system, but also it can cause some paralysis of the diaphragm, which is a muscle, and that leads to difficulty breathing. When you couple those two together, they can cause an overdose.
Shut them down.
And it's being, you said it's being mixed with other drugs.
It is. By the time these illicit drugs make it to the street, to a local street dealer level, they have been modified, added to, things taken away from them and added to them to make more product, right? So that the people that are selling the drugs can make more money. It's all about money. And in order to kind of bump that potency back up, the street level dealers are adding things like fentanyl to drugs like heroin or cocaine or Oxycontin or Percocet, things like that.
Okay, let's talk Narcan for a second. How does somebody utilize Narcan?
Narcan, what we have today available to us is very, very simple to use. They're basically little one-time use auto injectors now. And it's really simple. You insert the nozzle into one or the other nostril, you depress a plunger, you wait for a brief second, and when the dose is gone, you pull it out, and that's it.
As simple as it is, there is training
Yes.
you can get. How do you get trained?
So a lot of the health departments offer the Narcan training or naloxone training, and it's free of charge. So we have that training at the Somerset County Health Department. If you don't live in Somerset County, you can go to the Wycomico County Health Department, Worcester County Health Department. They all offer the trainings free of charge, where we actually will equip people with the kits and train them on what to look for, what are the signs of an overdose, and how to respond. And it's important too that people know for Narcan, the effects of the Narcan only last 30 to 90 minutes in the person. So it's an important message for people to understand to still get medical attention.
I didn't know that. I didn't either.
No.
I didn't either.
I knew that sometimes people, once they lose the high, they would try to go again and get another one, but I didn't realize they could come back to get you.
Yeah.
So what are the kinds of things is the Somerset County Health Department trying to do to reduce the number of deaths, reduce the overdoses?
We're trying to do anything we can in our power. We're doing a lot of messaging coming on here today. We're doing a lot of billboards, commercials, which Lieutenant Johns was actually in one of our recent commercials for us. We're having events. We're getting ready to do a mass mailer where we're going to mail out resources. So anybody in Somerset County with a Somerset County address will receive a postcard with information on it for how to connect to services.
Elizabeth Justice with the Somerset County Health Department and Lieutenant Ray Johns, Somerset Sheriff's Office. Thank you both. Very important information.
Absolutely. Thank you.
Thank you for what you're doing.